Hey, everybody, and welcome back to another episode of the Bulletproof Dental Practice Podcast. See, I almost did another podcast, Jenny. I had to remember what we're doing here. Today, I've got Dr. Jennifer Perna. You may know her as Yogi Dentist, one of my favorite people. And she hit me up a couple of weeks ago and said, "Hey, I'm getting a lot of information about something going on in dentistry." So that was the genesis of this. So, Jenny, really excited to have you here. Always excited to have you here. And fill the listeners in. What are we going to be talking about today?
Well, I appreciate you having me on here as always. And I appreciate you taking the offer to podcast with me on this topic. Basically, it's something that I have experienced myself. I'm very passionate about myself. And I tend to get a lot of direct messages on Instagram about this topic. And the topic is, I hate dentistry. I hate my career, or I think I do. I'm burnt out. I'm tired. Dentistry isn't what I thought it was going to be. I don't know if I picked the right profession. And these are just a few of some of the topics that I get. I get it a lot from new grads, but it's not just specific to new grads. It happens throughout careers. I've met people at the end of their careers ready to sell their practices that I'm afraid if they don't offload this practice, that they're going to hurt themselves because they're so burnt out from the profession. And so it's something, like I said, I've experienced early in my career, and we can get into that. And something that I consciously made a decision to try and overcome and find, what can dentistry do for me? What am I looking for? And what are the avenues in which I can have this profession fulfill me and I can fulfill the profession? So I'm just very grateful to be talking about it and be able to talk to you about it, because I know you have such a wonderful perspective and it's also a passion of yours.
For sure. And it's also because I've suffered a lot as well. Throughout my career, I've been in dentistry for, holy smokes, like 24 years. So like I got into dentistry when you were 3, Jenny.
Is that true?
No, I don't know. It sounds good though. Just let
10,
it go.
Maybe 10.
It's fine. Just let these things go. So, and I've had so many iterations of my career, and I've taken some big risks, and I've felt unfulfilled and sad. And it really just pains me because I don't know if you listened to, we had a recent podcast with the guys from Shared Practices, or one of the guys from Shared Practices. And I asked them very point blank, I'm like, at a macro, what is the single largest issue facing dentistry? So in my head, I'm thinking depression, suicide, unfulfillment. I mean, we're leading the pack in a lot of those things. And it's really quite unfortunate. Mm-hmm. And his perspective was same store sales growth. That was the single largest thing that was affecting dentistry. And I think that we don't have an outlet. And I'm proud that if this podcast can be the light for somebody to, and I've experienced that, and with past listeners, they've come up to me and said, like, this has helped me a lot. So just before we hit record, I said to Jenny, like, listen, we're going to have, potentially thousands of listeners on this. Some people are dealing with an acute crisis at the moment. They're like, oh my God, this is perfect timing. Thank God for this. And other people are like, I'm pretty good right now. Everything's kind of going okay. But, life can have a tendency to kick you in your ass. And when you have everything perfect, things come around, traumatic events and business events and stuff, and it can bring you down to your knees. And I think if we could just help, if this podcast reaches just one person, there's somebody out there that's feeling alone, to know that even, quote, and I'm using air quotes for those that are not listening, successful people like Jenny and I still have breakdowns, still have feelings of despair. Is this all I really wanted? Am I getting it? Am I satisfied? Am I doing the right thing? Did I choose the right thing? And I think a lot of it is just your mental state. And you have almost like, there's a good you and a bad you on either shoulder. And at any given moment, you can choose to feed one of those voices. And things are real. The struggle is going right now. And not only in dentistry, Jenny, but we were just talking before we hit record too. Depression rates, according to the article I was just reading, and again, we are not mental health professionals. We're just kind of dentists who are dealing with our own stuff. But depression prior to pandemic was 8.5%. And then recently it was recorded at 32%. So to go from 8.5% of Americans saying they're having depressed feelings to 33, it's not just a dentistry thing.
Right.
It's a bigger issue.
Right. And a lot of the people that, we post a question on Instagram with a lot of my followers and your followers to ask questions. And a lot of them are coming from graduates that graduated in 2020. And we
I
were talking
saw
about
that.
this. It's right. They graduated in the middle of a shutdown. And I couldn't imagine being a new grad trying to find a job, graduating with this enormous student debt, trying to find a job and trying to navigate this career while a pandemic's going on. So, I think a lot of dentists are facing different challenges from the new grad to, a seasoned dentist as well. And it's a topic that we should talk about.
For sure. And I think so. Let's jump right in. Let me think about the causes. Or pardon me. Let me discuss with you the causes. What do you think is causing this? Like, give me some of the ideas that you think are causing this.
Well, I think let's start at the new grad, right?
Okay.
So the new grad, there are a few things. Enormous student debt. We just talked about that. A lot of people, you don't learn much about the real world of dentistry and dental school. So you don't know how to find a job. You don't know how to add value like to yourself as a practitioner to look as an appealing candidate. There's very little guidance and mentorship. A lot of people will say, I'm looking for that unicorn opportunity for a mentor. And I really think it's a shame that has to be a unicorn. We really, as dentists that are been in the profession, kind of need to take on new grads like under our wing in some capacity and help them navigate this profession. I think a lot of new grads are thrown into corporate entities. There are going to be good corporations. There are going to be poorly run corporations. And I think with that, if you're in a corporation that's maybe poorly run, and this goes for private practice too, that the expectation versus reality of dentistry just don't align. And it causes a lot of second guessing. I think it causes a lot of stress on the practitioner. We don't learn how to lead a team in dental school. We don't know how to talk to patients.
Yeah.
Grads are
handle
still
conflict.
handle conflict. New grads are still trying to navigate being a dentist and practicing dentistry.
We're really poorly equipped. We're really poorly equipped.
I think that's a good summation of everything that I kind of just listed off.
Yeah, it's unfortunate. I was lucky enough to jump into practice right at the get with my dad, and he was able to guide me. And it's interesting in our practice environment. We have so many different doctors supporting each other, so it's really it's a nourishing environment. But the average person coming out that doesn't have either a father like I did or a supportive network, it's truly frustrating. And I read some of the comments and like dealing with patients, and patients are upset. And there's one person was saying to you, I saw that DM, it was like, they thought they prepared too much off their crown, and they went on YouTube, and that you ruined my teeth. And, there's nothing worse, because what has us go into dentistry is we want to help people. Right. No one's like, I'm going to go into dentistry because I'm going to make a ton of money. It's like, you think about being a dentist and thinking about giving care to people. And then to have somebody, when you do your very best and have someone say, you ruined me, you harmed me, you damaged me, it's so shocking and disturbing to your core, because it's not who we are as dentists.
Right.
So I remember feeling those feelings, and you have to actually fight your way out of those. You can't just be like, oh, I'm sorry you feel that way. Like, that's absolutely not true. And that takes time. Like, at this point, if someone said to me, like, if I did IPR on them, they came in and be like, you ruined my teeth, I would be so able to defend myself. Right. Because I'm like, I've done 3,000 cases and tens of thousands of spots of IPR. And there's no way I'm going to let you tell me that. But when you told me that the first time I did it, oh my God, that leveled me. I wouldn't be able to defend myself.
Of course, because, when you're starting out as a dentist, you're navigating the world of doing the right thing, and you don't have that full confidence that you're always making the right decision.
No,
and the
you're
truth
not.
Is,
yeah.
And I think a lot of dentists, we're perfectionists. We want to do it absolutely perfectly. And if a patient comes back like that, it can dishearten you. And there's a really, really good quote that I love, and John Coyce has it at every single course. And it's a quote from Maya Angelou, and I think it fits in really nicely here. And it's, do the best you can until you know better. Then when you know better, do better. And I think
love that.
It's so good. It's
oh my
so
God,
good. It always hits you.
Awesome. And I just got goosebumps with that one. Do the best you can until you know better.
Yes.
And then when you know better, do better.
Do better.
Oh, beautiful.
Yes.
You know what that's, know what that, I just want to put a pin in that. You know what that is having grace for yourself, grace for your situation. There's a lot of negative dialogue, and it crushes me when people disparage other dentists, because that fuels a fire that consumes all of us. You don't know what it's like. You can't judge a crown on 15 because that person may not have been able to open, and you don't know what's going on with that day. And maybe the dentist is having a bad day. We've all done work we're not proud of, and we redo it. Shit happens.
Yes.
But having grace is huge. I really do believe that.
It is. I learned that lesson in residency. I remember I had a patient, I brought it to my attending, and it was a filling. And I think it was just like a really deep amalgam filling, and there was just something wrong with it. I can't remember what. And I was judging that filling, and my attending pretty much, schooled me and said, you weren't in there doing that. You didn't, that was a very hard thing. And they did a very good job for probably what was presented. And I will never forget that. That was 6 years ago. I will never forget that conversation. And I hold that to every single patient that comes into my office. If there's work that I don't think is perfect, I remind myself that I wasn't the dentist who did it. I didn't know the circumstances, and there's no,
you don't know how it presented. So, I mean, invariably it could have been the dentist that you're disparaging or thinking critically of. It could have been a redo of a crown. So the crown was prepped by somebody else, and it's really unfair. We have too much judgment in it. And what I like to tell patients, and I just say this all the time, I'm like, listen, they're like, was this done well? I was like, listen, you asked 10 different dentists, you get 10 different opinions. I happen to like chocolate. This is vanilla. They're both ice cream. I have a different way of getting it done. Well, why do you have to modify it? Because I like chocolate. I like to do things a different way. We have, CEREC, and the prep needs to be different, but I will not say it. But I used to, Jenny, I didn't learn the lesson in residency. I learned the lesson, like you learned it early. I learned it later. I had to do it a lot. I just couldn't help myself. It was a way of actually making myself feel good. Tony Robbins always says there's 2 ways to make yourself feel great: be great or tear everyone great around you down. So it's like, you want to be the tallest building, you can build the tallest building, or tear the tallest building down. And at that point in my career, I was insecure, I suppose, and it was making me feel somehow better to put other people down. And now I know it just hurts everyone when you do that, including ourselves.
I agree. And I think it's, to go back to kind of supporting one another, especially because we're all facing challenges within the profession, and to uplift one another and to have a community, and to not throw other dentists under the bus to make yourself look better, because it really doesn't. It makes the profession look bad. And the patient
won't like you either. By the way, when you do that, they get mad at you.
Right.
When you throw shade, you look shitty.
Yes. You don't look like a good person. But I do love that analogy about chocolate and vanilla ice cream, and I'm probably going to steal that now.
Steal it. I mean, it's not stealing. We're actually giving this. I mean, this is the community that you're talking about is what we're trying to foster right now here. So whether you're alone or you're feeling bad, this is just stuff that we're all dealing with. And it's just normal. It's just normal. And I do believe that, for the new grad, it's overwhelming. You've got COVID, you've got the pandemic, you've got, all these different things that are going on. And it's harder because you don't have a lot of context. So for those of us that have gotten out before, we know there are better days and there are easier times. So, but like one of my favorite books, The Obstacle is the Way Through. You're going to get your butt kicked, and you're going to dust it yourself off, and you're going to get up, and you're going to keep going on. And that's, I think, what actually leads to the most amount of fulfillment. It's not those who have it easiest. It's those who fall and bounce back up.
Absolutely. And life is going to throw things at you. It's just the nature of life. Things are easy when it's easy, and it's always going to be easy when it's easy. And you're going to think you have everything put together. But when things start to occur, pandemics happen, staffing issues happen, upset patients happen, you have to find tools in which to navigate those situations that maintains your mental health, that, you don't let it beat you down. And it's hard, and it's a practice. And I don't have all the answers. Obviously, we all just navigate.
The Stoics did a lot of this stuff. I always talk about with Peter in the podcast that these problems that we're talking about today are the problems of humans, and they've been around for thousands of years. And when you read the Stoics, the Stoic philosophy, Seneca, those guys, it was really about understanding that you have an emotional side to you. And when you get triggered emotionally, you can't think clearly. Mm-hmm. So we're all sitting here, things are okay for the moment, but things happen, and then you lose your cool, and you have to regain your composure, and you have to rebalance your mental state. And that's just totally normal. I think most people suffer greatest because they actually feel they're the only ones suffering. So they look at Jenny, they look at you, or they look at me, and you and I we do a really good job of making our lives look great with our social media.
Oh, for sure.
You know, we try to do that. It's just in our nature. We show the good stuff. We all try to show everything, but people are sitting there thinking like, oh my God, Jenny's got it all. Look at how, she's got everything figured out. And they don't get to,
she doesn't.
I know she doesn't, because she's human. Or Craig's got it all figured out. I want what he has. Look at that thing. It's amazing. He's got, Tony Robbins' patient. Amazing. And they suffer because like he's got it easy. And although I love my life and I'm super fulfilled, knock on wood, I don't have it easy. And the reason why I think I love my life so much is because it is in direct proportion to the amount of ass kicking I've had. Like from employees suing me to like 2 doctors quitting on the same day. I've had like some really, really rough days. My son being airlifted out of, last summer with a ruptured spleen, and I'm on a medevac. Life is not always going to be easy, but it's the suffering and the down moments that expand your ability to feel. And I think that we don't want to feel anymore. We believe that suffering, any form of suffering, is cruel and unusual. And I think when you go through bad times, you're expanding your senses to feel. Like I've talked about that. I think I even talked about it with you. It's like you think of like you have a pipe, and your emotions have to fit in a pipe. And imagine if your pipe has to be stretched like wider to a tunnel. So like the negative emotions can actually stretch you. And when the positive times come, you actually feel more positive emotion as well. So I think what we're doing as a society is when we suffer, we're running off, and a lot of people are taking a lot of meds, and the meds may be useful. And I can't speak to the scientific nature of the meds and what they do I'm not a clinical psychologist, but I do know they modulate the suffering. They modulate the downside. But if you modulate the downside, you modulate the upside. So you just feel less. And I think we're meant to reel me back in, Jenny. I'm off. I'm all alone here.
No, I love when you go off on your tangents too, because every time I speak to you, I just learn more and more, and it's very insightful. But I completely agree. I look back at my life, and yes, what I show on social media, I try to show a lot of good. That doesn't mean that I don't go through things, but I also don't want to use my platform to complain about my life on a day-to-day, So I think that social media can have a huge effect on people's mental state as well. But when I look back at my life and the challenges I faced, those are the moments in which I'm most proud of. I'm proud of, who I came out on the other side as. I'm proud of the determination and the strength that I was able to show. And I'm also proud of the vulnerability and the weakness within all those moments. And like you said, it gives you the capacity to feel and be human, and to realize that we're all going to face challenges. We're all going to have moments of complete despair. To get a little personal, Vince and I did a little bit of a fertility thing last fall, and I won't go into it, but it was something that I was on the couch bawling my eyes out at one point, and I didn't show that on social, and I think I'm starting to get ready to be able to talk about it more. But
good for you.
I think that, and it was all proactive to be clear. But
I know, but it's supercharged, Jenny.
It's hard.
The whole thing, because I have a lot of women in my life with 50 female employees and all that, and the fertility thing, I've come to appreciate how charged that is. Because from a man's perspective, it's like, okay, well, there's a process. And for a woman, it's like, it is so charged, and there's so much suffering around that, and shame, and I think that, we're going to touch on something else, which is shame. I think, because I think shame is actually probably something that's causing this, because people are coming out of school, they're looking at Instagram, they're seeing what other people can do and what they're up to. And they're like, I'm not doing that. And rather than say like, well, it's not, I'm just learning, they don't give the grace for themselves, and they feel that they're not good enough. So the difference
Right.
between guilt and shame is like, guilt is like you feel bad about a behavior that you exhibited and you make a difference. Shame is you actually feel bad about yourself. So it's like, I made a mistake versus I am a mistake.
Right.
So I think that the people saying to you in your chats, like, I think I made the wrong decision, I'm worried
Right.
about dentistry, they're actually feeling shame. Like, I fucked up,
Yeah.
basically.
No, and I fully agree. And I think there is a lot of shame that surrounds a lot of different circumstances in our lives. And when you speak to like social media, everyone is really trying to put their best light out there. Very rarely are you going to see, someone posts a veneer case, right? Well, you're not going to see how many times they sent that case back to the lab to get it perfect. They're not telling you that. And then they're not telling you the amount of hours spent practicing to obtain these skills that they now can post on social media. And I
Or the
think
fact, or Jenny, one more thing, or the fact that you and I look at that social media post and it's like literally perfect results, but
yeah,
they're not posting that the patient was actually unhappy with it. The
right,
patient wanted four incisors that were completely square and flat across, like,
right.
like something
Our
unrealistic and
nightmare.
ugly. Yeah, our nightmare. Like, oh my God, there's lines in my teeth. It's not all one color. I wanted my teeth like the porcelain toilet bowl. So we're
Right,
not even posting that the patients aren't even happy sometimes with our perfect
right.
work.
Exactly. And new grads see it, people in the middle of their careers see it, and it can be really disheartening. And I think you're absolutely right that it's centered around the emotion of shame. And I always, anytime I get these DMs, I always try to direct, like, especially new grads, back to the fact that, like, this didn't happen overnight. And you just have to keep growing and growing within the profession to be able to obtain these results, and don't allow it to bring you down, but rather allow it to inspire you. Look at the case of someone that you admire and ask them, what were some of the courses you took? How many hours did you spend practicing this? How many hours have you been in practice? What are
Yeah.
some of the biggest failures you've had that you've learned from? Those are the questions to ask, not, oh my God, I'll never be like that. Or I don't know
Yeah.
how they're so good. Why am I not that good?
Yeah. We
You
get
know?
rewarded in public for the things we practice intensely for in private.
Right.
No one saw no one sees Michael Jordan going at 6 a.m. just doing free throws and free throws. They just see the game. I'm like,
Right.
man, look at that. I mean, the guy was kicked off his high school basketball team,
Right.
so no one sees all that. They just see the showtime. But I think there's a technique, by the way, and I want to add something just kind of tactical for people when they're being challenged by a patient. So when a patient is challenging you or they're thinking that you've done them wrong, human beings tend to back down when you use the phrases like my commitment to dentistry or my commitment to you, and restating like almost like your purpose. So someone's like, you took off the wrong amount of tooth, or is this one that was hurting you, that one, that all the things that or you should have known I needed a root canal beforehand.
Mm-hmm.
Just to kind of stand up. Like, don't look at those points as a time to retreat, because what a patient's looking for is they've lost trust in you and they're scared. And what they really need is for you to step into your dominance or your authority. And I'm not saying like, who the hell are you? It's not that, but it's also like, hey, Mrs. Jones, I hear what you're saying. My commitment is to do the very best dentistry on every single patient. I treat every single patient if you were there in my own family. I'm really sorry the way you feel, that you feel this way. But I'm not going to ever waver from my commitment. My commitment is to always do the very best thing for the patient. And if you were my spouse or my child, I would have done exactly what I did, and I wouldn't change a thing. And that's, you're not telling them to, screw off, but you're getting a little bit more dominant. So when someone wants to challenge you, it's always an opportunity to turn something around to something more positive. And I think a lot of the conflicts that have happened, I've been able to navigate because I didn't really shy away from them.
Mm-hmm.
And even
I think go ahead.
no, go ahead. No, it's fine.
I was going to say, I think it comes down to a lot of confidence. Oftentimes, if you're not confident within your skill or how you're approaching a case or anything, patients can read that.
But are you confident? Yeah, I understand that. But this is a different thing. It's a confident in your motivation. It's a confident in what you stand for. So you're not saying, hey, Mrs. Jones, I've only prepped 6 crowns. I'm really sorry. Because that's different.
No, of course.
It's Mrs. Jones. I became a dentist to treat every single person with the most care and sincerity I possibly can. And that's what I did with you. And I'm sorry you feel this way. But like when you kind of say like that, your commitment, your life's work, something more authoritative, it can actually resolve a lot of things rather than shy away.
I
And
think
when
that's
someone's
wonderful
attacking
advice.
you, you kind of shy, you know, the natural is to shy away. I tell my entire team, when someone's upset, get excited, because when they vent and you're still kind with them, they have a little bit of guilt. They feel bad. You know, so the person that's ranting online and all that stuff, someone's texted you that, I would leave them a public message like, hey, John, really sorry that you feel this way. My commitment is to take the very best care of every single patient. Please email me anytime you want, call me or email me. I would love the opportunity to make this right for you. And even if he's completely a DB and he wants to go crazy and he responds to that, like, go F yourself, he's the one who looks terrible. So you're writing it for the public opinion as well.
Right. And I think it's important to remember that we're not always going to be the provider for every single person in this world. And that's fine, you know. And I think when you first graduate, you have to be the person for everyone. And the truth is that's the nature of life, right?
It's hard to shake them, Jenny. It's hard to shake them. I've had people, I'm just like, before I start, I'm like, listen, this is not going to go well. I really don't think you should use me as your provider. No, but I really want you. I'm like, I know, but it's really not going to go well. And it didn't go well. And then the whole time I'm trying not to get them. I raised the fees. I've done everything I possibly could. And they still go.
And they still,
because it's like, how do you tell, like at a certain point, then they really, it's really hard. I've literally told people like, I don't think you're making a bad decision. I'm not going to be able to make you happy. Well, why do you say that about me? I'm like, because I can just tell by the questions you're asking and the things you're saying, you're going to not be happy with me.
Right. And it's an important skill to learn, because I think too, oftentimes you want to do, you're excited to do a case or something, the case presents and you're just so excited to dive in and to do this case. And you didn't realize the personality attached to the case.
And cosmetic dentistry, by the way, is not about the dentistry.
No,
not at all.
It's about the psychology.
It's the psychology. So like regular dentistry is like, hey, Ms. Jones, you got decay. We got to fix this. You need to fix it. If you don't fix it, root canal, crown, implant, blah, blah, blah. Let's roll. Cosmetic dentistry is like, here's your life now. Come follow me on this journey of making your life better, feeling more confident, feeling better about yourself. Bullshit. You fix the teeth, you don't fix the brain.
No. And it's something too, whenever I have a patient, and this is a little tip, if there's ever a patient that is coming in for a cosmetic consult and I'm a little concerned about their expectations versus what we're going to be able to deliver, I will do like a motivational mock-up that I'll put into their mouth and let them look at it. Super important. I've had patients where they have those, the mock-up in, and they are very, very analytical and they're worried and they're concerned. And I'll have an honest conversation of, are you ready for this? Are you ready for this change mentally? Because if you're not ready for this today, then I don't suggest we proceed. We can probably proceed in the future, but you have to be psychologically ready for a life change to be able to proceed within this dentistry.
And then also painting a very realistic picture around the healing time, new teeth, new musculature, new phonetics, like just telling people, I love this from Dr. Liesel in my office. She says, don't do me a favor. Don't love this or hate it for a couple of weeks. Suspend judgment, because it's almost like when you install like your refrigerator and the delivery guys are about to leave, you have to sign off on that shit. If the refrigerator's in the wrong spot, you didn't like it, you're done. And I think patients feel that way with dentistry. The minute it goes in, it's like in the chair, it's like, hey, just don't love it or don't hate it. I'm here for you. If you think number 10's too long or number 7 or 10, we can always redo it later. Just don't you have to heal. You have to learn how to re-speak and your phonetics, your musculature. We added 3 millimeters of tooth structure, open your bite. So I think that like not allowing them to kind of marinate with it, not feel so rushed to like it or hate it, is really a powerful tool. And also figure out their motivation why. Clear aligner tips, since you gave a tip. When you ask patients what they don't like about their smile and or what they're looking for, obviously you see their crowded teeth or you see what's going on. You have the reasons that you want to fix their smile, but find out what it is that they want. So they may actually say like, I just don't like when I turn to the side, you see how my lip kind of curls in? I'm like, yeah, I mean, not really, but tell me more. Well, I just know that when you put my teeth in the right position, my lips will be fuller. I'm like, okay, I'm really glad you said that, because I can't promise you that at all.
Right.
Yeah, I appreciate that you think it, but if that's the primary motivation for you wanting to straighten your teeth, let's not do it. Because there's other reasons, because your teeth are crowded, you can't clean them, and they're wearing and blah, 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 blah. But if that's the primary reason, let's not do it. And like, no,
Right.
no, it's not the primary reason. I was just hoping. I'm like, let's not hope on that. Let's not plan on that.
Let's also treatment plan some lip filler for you.
Exactly. Exactly. Or it's like, I want to do my veneers because I know I'll get a boyfriend or a girlfriend right away. Yeah, let's not do that.
Let's not plan on that. Don't put that pressure on me.
Exactly.
But I think these are really good tips for just managing patient expectations. And I think that leads to better relationships of trust with patients, and hopefully less and less and less complaints or concerns from patients as you continue to practice. So I'm glad that we went over some of those tips.
Of course.
So something that I noticed, some people writing in as well, are people, to get off of the new grad topic, is more people that are seasoned within their careers right now, but they're facing challenges with the team, especially during the pandemic, and being able to hire people, being able to keep valuable team members. And, I think this is a avenue in which you obviously have a lot of expertise, and especially with like the mastermind and hearing the challenges that those individuals face, and maybe some tips of navigating just, working with a team and having to navigate a team dynamic during this time.
So I have a tip, and if I had to distill it down to one tip, because I think there's many, but there's just one thing that you could possibly do that could shift everything. And I've seen it happen so many times. When we get upset, we go inward. When we don't get appreciation, we go inward. When we don't get the love we want, we go inward. The hack in life is you get what you give. So the team is people that work for in our practices, especially, assistants and those types of wage earners. Those people are under extreme stress. When gas, fortunately for me, at my situation in life, if gas goes from $2 to $5, it doesn't affect my life. I'm blessed. It doesn't affect me. I don't even care. And I'm not trying to be cavalier, but what I'm saying is that we have to get into the perspective of what's happening for those people that work with our practices. And the way in which you can make your team great is by just appreciating them. It's the largest portion of our expense line of any P&L. If you're doing it right, it's around 25 to 30%, your team, your support team, your team wages and all that. And what I've learned is that when people are feeling most dark, and I talk to a lot of dental business owners, I tell them just start appreciating those people. When you trade your expectations for appreciation, your life changes immediately. We're expecting too much from people. We're not appreciating them. And that's something you can literally, if you're listening to this on a weekday, you can literally stop this recording and go around to 2 or 3 people. And maybe it's not a work day. You can just send a text message to 1 or 2 of your people. Hey, Janet, really appreciate, that you stayed late the other day. It means a lot. I'm not great at appreciating, or maybe I'm not as good as I should be about it, saying how I feel, but I just want to let you know how I appreciate you. Your team will light up. People light up. When I feel depressed or upset, I find all the people I love and appreciate. I start texting them like crazy. I just do that with people.
Yeah. I think you bring up a really good point, and we have to look at our team that we're working with them and they're not working for us. Right. And so we are, in the nature of the name, we are a team. And I think as dentists too, we often have this mentality, because when we go in and we see a patient, we are looking for problems and we're looking for solutions. So often with the team, if things are maybe not going the way that we anticipate, we have problems and then we'll create solutions. But we also need to remember to appreciate all the things that they do within the practice. And is it maybe to the level you want them to do it? Yeah, I'm sure there's some things that your team is doing excellent, and you need to recognize that, exactly what you were saying, and obviously make them feel appreciated. I think that's such a good point.
And it's a tool I learned from the greats, and even the people that are the greatest that I love the most and have the most amount of respect. My mentors do that. You see these people, and I've lived, now, I'm 50. And I see successful people, and what I call successful people who are fulfilled, present, and happy, and I see people who are they have recurring themes in their life, and they're just able to appreciate things. They're able to appreciate the small things in life. One of my buddies, John, he's a very, very wealthy man. He has all the things that a wealthy person would have, big yachts and jets and all that stuff. And I have the ranch I'm always talking about. I've told you about it before. And I have a trailer there, a very small trailer. It's actually funny because there's people that live next door to me it's a homeowners association. And they were talking about the person, they were meeting me, that lives in the substandard living conditions next door to us. And they were referring to me because I guess it's a trailer or whatever. And my buddy John winds up looking in my trailer the other day. And he looks to the left, and he looks to the right. He's like, Craig, I could actually live here. And he meant it. So he has all this great stuff in his life, but he still appreciates the simple things. And I always say this, and I got it from Tony himself, the science of achievement. And we're scientists at heart. We know how to do the crown prep, the 5 steps to this, the 4 steps to bonding this, the diagnostic criteria and the way things go. But life is a fulfillment. It is an art form, and fulfillment is an art form rather. And it's really incumbent upon us to figure out what makes us happiest, really do a deep dive on it. Don't hijack other people's beliefs, and really find out what it is that makes us happy. You can't hijack someone else's vision. You can't go to some weekend summit and then realize you need to open up 7 or 10 practices or learn the 7-minute endo or go through COIS. You got to figure out what makes you tick. And once you start living authentically and what you want, it'll provide you with the fulfillment that you want. And you will go through tough times, and you will get your ass kicked, but you'll wind up being fulfilled.
When I was putting together, kind of some of my thoughts for the podcast, I thought about what advice would I give, in these circumstances. And my number one advice is actually from you, when you always say, know thyself. And you have to really dig deep to know what you want, to then know how to go and get it. And so if you try to hijack someone else's vision for their life and their career within dentistry, oftentimes, even if you achieve that, you're not going to have the fulfillment that you thought you would have. And so I think that's an excellent point. And I encourage everyone to really dig deep. And it's hard to really know what you want. You don't know what you don't know. So, figure out, what do you want professionally? What do you want personally? How do you want to be fulfilled financially? And then how does dentistry do that for you?
Yeah. If you don't know what you want, you'll never get there.
Absolutely.
You'll never get there. And there's so much competition. I mean, I think that's why Hollywood is really filled with a lot of people who are deeply, deeply unhappy because, think about like being a child and acting and then always competing to try to get a part, to try to get a role. You're literally got blinders on. You're running towards a goal and you never have a chance to examine it. All of a sudden you get there and you're like, oh shit, I'm famous. Like I've made everything I wanted. This is it. And now all these people love you and they don't even know you. And you never really thought about what it is you really wanted. You wanted love and connection, probably like most humans do, but you wound up getting fame. And that's a really crappy substitute for love and connection because they like you for the wrong reasons. So I think it's really just incumbent upon each person to figure out what makes them tick. And, I keep saying about 50 that I'm 50 because, even at 42 and 43, I was not as fulfilled. Like there's a lot of stories amongst my office of like, oh, I remember, I've heard how you used to be, Dr. C. They call me Dr. C. I've heard how you used to be. And I can't believe you were like that. So for those that are, 28, 32, 35, or even, 50 years old themselves, just give yourself a little bit of grace. Know that we're all on our own timeline. I just had to go through a lot of stuff. I had to, mellow out and see what I was doing, see the damage I was causing. And I don't regret any of it. I don't wish I went through the path I was supposed to go. I think, another thing is like life happens for you and not just to you. You get exactly what you need. So if you're upset about your family and your mom and dad weren't the way they were supposed to be, and I wish I had Jenny Perna's mom because she was so great. You got the mom. She was.
I do have to give her a shout out.
Right. But you got the mom and dad you needed. If you had the perfect parents, you wouldn't be exactly who you are. And you said something early in our podcast that you're really proud of who you are. That pride comes from being aware of your strengths and your weaknesses and giving yourself grace. You can't sit here and just say like, my life is bad because of this stuff or that stuff. You have to realize it's all for your development, all for your growth. The wind blows hard on the young tree, and the roots grow deep, and and everything shapes you. Everything in life shapes you. So whatever you're going through, if you're going through something right now, if you're really feeling like you can't see your way through it, you don't have to have the answers right now. Just know that it's for your greater development. There's always a silver lining. Everything in my life that I was sure was the wrong thing for me wound up to be, oh my God, that was actually really good. And it was crazy. It's like I had a bank that when I built this building, I heard a rumor that the bank was going to be sold, and it was a very risky thing for me to build this building. I borrowed millions and millions of dollars, and the banks literally all rejected me, but one said yes. And I was very scared because I knew I was way over my head. And I said, the bank's going to get sold. And they said, no, we're not going to get sold. Don't worry. Because my fear was if the bank got sold, I wouldn't have a relationship if I ran out of money, and they wouldn't know me. They wouldn't be able to like sell myself to like give me more money. Mm-hmm. And long story short, the bank did get sold. And I was really nervous because I did run out of money. But in the fray of the bank being sold, which I thought was a terrible thing for me, they lost my paperwork. And instead of the money being due on like January 1st, I got like a loan from God because I got shuffled around with the transition of the new bank, and I didn't have to owe that money for months and months and months. So the thing that I didn't want to happen happened. I suffered. I couldn't sleep. I was upset, only to find out that it was the very thing that got me to where I am today. Because without that, I wouldn't have probably had the float, and I would have gone out of business because of cash flow.
Yeah. I mean, I think that every instance that challenges us gives us an opportunity to grow. And, you brought up having a different mindset around it and looking at those challenges as opportunities. And I know it's a book that you guys have talked about, but Mindset by Carol Dweck is fantastic, of having that growth mindset and not a fixed mindset when you're navigating life and looking at perspectives. And I just reiterate the fact that I am grateful for all of those challenges. From, my very first job was something I would cry about. I would go home, I'd pour myself a glass of wine, and I would cry because I was so concerned that I put myself in so much debt for a career that wasn't going to fulfill me. And there's a really funny meme, and I think it's really good for undergrads. And it says, "What's the strangest thing you've done for cash?" And it's, I took out a loan to go to school so I could get a job to pay off my student loans. And I think that's how I felt. I felt that when I had first graduated, and it's a lot of stress. But now I look back at that opportunity that I had, and I look at everything that it taught me about this profession.
Well, also gave you freedom too, Jenny, because no one can repossess that knowledge. You could literally look at the United States and say the coolest possible town there and say, I can make a living there. Who can say that?
No, and that's the truth.
So when Dentistry I did this big building, when I did this big building, and I said, okay, what's my plan B? Because it was really close, Jenny. I was really close to failure, really close. Like when the building, I had like a $35,000 payment coming. I had a $40,000 payroll. I had no money. I had a yellow piece of paper with all my rich friends I was going to borrow like 10 and 15 and 20 grand from. It was really, really hectic. But I said, okay, the worst case scenario, I remember going to Carmel, California, and I loved it. I'm like, you know what? If it all blows up, I'll just like work with somebody there. Got to be one or two chair practice, and I could be fine. So that security, what you've bought for yourself, those that are newly graduated and feeling oppressed by your student debt, you've bought the freedom and the ability to work anywhere, anywhere.
And dentistry, and this is something that I always try to speak on, dentistry has so many avenues to quote unquote success. And you can take a multitude of avenues, and that's the beauty of this profession. And so if you're finding yourself stuck within an environment or a position or a situation that's not fulfilling you, you can change it, and you can cultivate what you want. And that can look like anything to you. Yeah,
you just have to be imaginative. I was working with one of our masterminders, and he's like talking about, he does a lot of frenectomies on babies. And he's looking at his new patient numbers and frenectomies on these babies. I'm like, why? He's like talking about he's doing a video. He's going to start video advertising. I'm like, so you're going to do more of this? I'm like, that's awesome. What do you love about it? Oh, well, I don't like it. I'm like, well, why do you do it? Well, because when I first started, I was the only guy who did it. And the moms like really wanted me to do it. I'm like, so why are you continuing to do it? And he had no answer.
Mm-hmm.
So it's like there's a Thoreau quote. It says the unexamined life is not worth living. He doesn't know himself. He's
Mm-hmm.
just doing the same thing he's always done. And I always ask why, like I'll tell people like, what do you think of my practice? I'm like, listen, I can't tell you that because your life might drive me crazy. And I'd want to fix everything about your life to suit my bias and my needs. But your life is not for me. Your life is for you. So I'll ask, what do you think about that? And then like, well, blah, blah, blah. And they'll start opening up. I'm like, perfect. Now we're getting somewhere. But
Right.
I think in dentistry, one of the largest problems outside of, the other stuff we were talking about is that there's a lot of consultants or, using air quotes for that will actually tell you exactly what you need to do, Jenny.
Mm-hmm.
Like when we've talked, I'm like, hey, you got to do what makes you happy. And we've done like the culture index and stuff like that, like just to point out your strengths and all that. But it's just important to make your life suit you and no one else.
Right. And I think, to speak on the culture index, and it kind of shines light in this, there's some people that are comfortable being uncomfortable, and there's some people that do not want to be uncomfortable. And to make any life shift, you have to get uncomfortable.
Yes.
And so some people will stay in a toxic space or a space they know is not fulfilling them because it's comfortable, it's regular, they know what to expect. And I fell victim to that within one of my associateships as well. I was stuck because it was just, I knew it was quote easy. It was never easy, but it was easy just to continue to do the same thing because I knew what to expect. And then when you get on the other side of it, you realize you probably should have left sooner. You probably should have redirected sooner and really figured out what you wanted sooner so that you can then therefore cultivate it. But
yeah, I don't think, I think looking backwards like that, and I think that's an important thing to talk about as well, Jenny, too. It's like, change doesn't take time. You change in a second. It's just the realization that you have to make a change could take years. So like once you decide, like in a bad relationship, like I'm done, this is it, this is the moment. It did happen in a moment, like literally got a call and like, screw this, I'm out of this. But it takes time to realize it's going to change. And I've looked at that too. Like I suffered a little longer. I stayed stuck a little longer. Just took me that much longer to realize I freaking hated where I was at. So
yeah,
I think that, you shouldn't have made that change sooner. Because now
I think that's a good point. I think, it took time to get to the point, and I agree with that.
right,
And
because
it's
you're a
not
caring
an
person
instant
who
thing.
pours your heart into things,
Right.
and you're loyal. And there was Cindy, the hygienist, and she was great. So there was good things about it. It was a toxic situation, but there was other things. Your job wasn't done. So
Right.
when you finally, it's like kind of being sick and tired of being sick and tired. The alcoholics, like they drink and drink and drink, and then one day, like, done, I'm done. But I don't think you should look back at that. Like, I just want people with my own experience through my 40s, I could have had a little bit easier if I didn't overindulge in suffering. I was oftentimes walking around, even with all the blessings of my life, like, poor me, I can't believe this, no one cares, blah, blah, blah. And that is caustic. It's toxic and caustic. And it cost me a lot of good people and bad and things around me. And I started realizing that, I have to figure out a way every day to appreciate something. So, that's important for me.
I agree. And, speaking on that, I think it's good to find tools in which outside of dentistry give you good mental strength. And that's going to look different for every single person. For me, it's very much exercise and working out and journaling and meditating and doing yoga. And those are my anchors. That's what keeps me mentally strong. For someone else, it might be drawing, it might be speaking to a therapist, getting massages, whatever it looks like. But again, knowing thyself of how are you going to stay mentally strong as a human in the instances in which you're needing to be really, really strong.
Well, I also think I appreciate you're being graceful with that, but there is an absolute truth to one thing you said, and it's not dependent on the person. It's that you cannot be mentally strong when you're physically weak. You can't. Dentistry is really hard on your body. The positions we're in, the static movements,
Mm-hmm.
you have to, if you want to be successful in dentistry, you have to exercise, you have to strength train, you have to do something. And by the way, I'm not talking about what you do and all the iron molar and, that level, but go for a walk, get
Right.
out, like listen to this podcast and go walk. That just
Mm-hmm.
walking. But I have so many people in my life that are overweight, and they're literally coming to me, and I'm biting my tongue because they're like, hey, I've gone to 3 doctors. They can't figure out what's wrong with me. They've done tons of tests. They can't figure, my knees are hurting. I just get tired all the time. I'm like, you're walking around with 100. I don't say this,
Mm-hmm.
but you have 100 pound, you have another human on your back. You're fit as hell, Jenny. But if I had Vince on your back all day, every day,
Mm-hmm.
your body, your knees, your body will break down. And I think
Absolutely.
you cannot, I hate my workouts. I hate going in every day on the way in. I'm like, I want it. This is the day I'm going to stop. I'm not going to do it. I'm quitting today, every single day. But the
Mm-hmm.
days I work out, I have better days. I'm
Right.
more mentally acute. I'm more positive. I have better energy. So that's not just, I appreciate your being kind about that. But that's not just what does that work for you. You must work out. You must do something physical every day, or at
Well,
least 4 or 5 days a week.
absolutely. I mean, I'm very passionate about that. That
You
is,
have to
like
be,
I
but you
said, it's
can't.
an
You're
anchor.
being soft though. You're like, it could work for you drawing. Yeah, drawing's not going to get your body in a space where it can be better.
Well, I think you bring up a very good point that dentistry is very taxing on our bodies and we can't ignore that. And so having mobility and being able to stay physically strong will help with the day to day in dentistry. And I fully agree. I think working out has been one of the absolute best things that I've incorporated in my life. I say I'm lucky in a sense because I was always active. So it was always part of my life. So when I get asked, like, how
You're
do you
lucky.
find time? I think to myself, how do I not find time?
Well,
You
you're
know,
either, I tell my trainer, I want him to coin this. Maybe he could coin it. It's either you're going to rehab or you're going to prehab.
mm,
So people will get like, I know that one of the reasons why like Appa works out so much is he had a really bad back. So he
mhm,
actually went through and had it the other way. And that's what typically happens in life. Something
right.
gets taken away from you and then you appreciate it. So, for those, for those that have been injured before, you start to appreciate, because really when you're rehabbing, you're just doing strength training.
Right.
So you might
Exactly.
as well prehab and not have to get injured.
Right. And to a point that you made, I don't think that we ever go into a workout and we leave it and we're like, man, wish I didn't do that. That
Yeah, but
was,
how do you
you
feel when
know,
you go in? Are you excited to go in? You
it's
probably are
day
one of
to
those people
day.
that are like, love it. I
It's day
freaking
to
hate it.
day. It's some days I'm like, I can't wait to get in the gym. Let's live in the gym. Let's just
Oh,
not leave the gym.
I don't think I've ever felt that way.
And then some days I'm like, you can't get me in there. I will not go in there. And it's in my garage. So I really shouldn't
Yeah.
have an excuse.
Yeah. If I
But
had a
it's
gym in my garage, I would never use it. I literally have to pay someone to drag me,
and
there.
that's a great tip. If if you're the person that doesn't want to work out, pay someone to do it. Get someone to make you accountable to do it. When
Yeah. I show
you
up, I'm like 45 minutes left, 44 minutes left, 43 minutes left. Are we done? Are we done? And then I have to like go back and thank my trainer, like, hey, listen, I know I'm a pain in the ass. Thank you for pushing me through it.
Yeah, I think it's great. And I will always support and advocate that people continue to strengthen their bodies. And I think even going for a walk, like you said, is a
Yeah.
fantastic way to start. And you feel good. You feel good after a workout. Your body feels good. Your mental state feels good. And
You'll
then
be
you can,
less depressed.
mhm,
You will find a way. So if you're also that person that's like, I've tried everything, I can't get in a good state, have you tried exercising?
mhm.
If you're not exercising, do it. You got to do it. I mean, I really appreciate the drawing comment. You can draw and exercise, but you got to get your body moving. It's the oldest secret ever.
Truly. And we all know this. It's natural endorphins. You're getting
It
pumped
is.
with
It is.
endorphins.
It
And
is.
I have a rule that I always try to stick by, and it's hard sometimes, but I really try to disconnect from any social media during workouts or answering texts or emails or anything like that. I'll listen to podcasts on my phone or music, so I will have my phone with me, but I really I try to disconnect a little bit and really just focus on myself. And I think that's a beautiful practice too, to prioritize yourself at times.
That's awesome. I want to tell you one, like a story about the sending out recognition that we were talking about just a moment ago. So one of our masterminders, really good guy, super successful guy in Texas, like making lots of money, great leader, really good guy, feeling unfulfilled and burnt out, probably like 45. Like most people would look at him like, damn, he's got everything, got a young children, everything's going really, really right, but he's kind of losing some of his passion, getting a little lost. And I was working with him. I said, listen, what I want you to do is I want you to start reaching out and just appreciating people. I want you to do 3 a day, text me when they're done, blah, 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 blah. And so he did one, he screenshot it to me, he texted somebody, and the person wrote back. And it's like, man, you have no idea how important. He just said, listen, I'm just kind of on a gratitude kick and just want to know that I appreciate, I'm thinking about all the people and I'm appreciative of, and you, good sir, are one of them. Guy writes back, man, you have no idea how timely this was. I'm literally in my in my kitchen, crying like a schoolgirl because I just lost, Clark's friend, someone just died. And it was just like, it was crazy that happened. And so it was this, and I wrote back, I mean, not to get spiritual here, but I wrote back to the guy. I'm like, to me, that's God. Like that's some sort of universal energy that connects all of us. And that's what you're experiencing right there. The very next day, so this person's been doing 3 a day and he was doing it every day. The very next day I had a meeting with my office manager, Erica, and Erica gets a text on her phone. She doesn't look, and she looks at it. Then her eyes get red and her face gets flushed. And I'm very emotionally aware, and I could tell it was either something's going to make her cry. Mm-hmm. So I was like, Erica, are you okay? She goes, yeah, I'm okay. I was like, is that a bad thing or a good thing? Like, I don't know. Like you look really upset. She's like, no, it was really, really sweet. So what it was this girl texting. It was an office manager of my friend that I told to text people and tell them they're gratitude, they're great, that they're great, that he's grateful for them. She wrote to Erica, hey, listen, I know as an office manager, it's a really lonely place. And I want to tell you that all the things you're doing through the Bulletproof office manager and the mastermind are helping me so much. And you're amazing and blah, 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 blah. Made Erica cry. Mm-hmm. So I text the mastermind. I'm like, hey, bud, just curious. Did you happen to text, I'll use a fake name because I don't want to out any of these people. Did you happen to text Jane the other day? He's like, yeah, I just texted her this morning how much I appreciate her. And so I'm like, this is the interconnected nature of it. So my buddy's suffering. I tell him to reach out for people. He starts doing it. He feels great. He reaches out to somebody else who then reaches out to someone very important to me. And that's we when we feel less love, give love. When you feel less appreciated, give appreciation. It's a hack you can do right now. Right. We all can find 2 or 3 people we're appreciative of. Pour into them. So if you're one of those people in a dark space and you really can't figure out what to do, go for a walk, as Jenny and I just said, and find 2 or 3 people to appreciate and really pour into them. It'll make you feel great.
I fully agree. I think that, really digging into what you appreciate about your life and the people that surround you within your life, no one's going to be sad if they get a nice text message like that. Yeah. Like it's so appreciative, and it's important to pour out, what you need as well. What you give is what you get. So I absolutely 100%. Love that story.
Yeah. Isn't that a crazy story?
That's good. That's wonderful. And I was going to call it a gratitude train, but it was more like a gratitude circle because it went right back.
Yeah. Right back into my face. Like literally, what are the chances that I would be there when she texts and she'd get all emotional? I'd ask her, I was like, are you okay? Did you just get, is Mason and her son's Mason? Is Mason okay? Like, are you all right? She's like, no, that was just a very pretty thing. And I was like, wow, I'm like, and then like, egoically saying like, okay, well, I caused that virtuous thing. I created that.
And that fulfilled you, I'm sure.
That fulfilled me, of course. Not in a way to brag about it, but like I just shifted someone who's great and let them shine their greatness on somebody else when he was confused. And he's like, why am I great? How am I great? I'm alone. And so I just think that this is the art of fulfillment, and the greats have done it in my life, and I continue to pass it forward. And I think that can help a lot of people. And that's actually what I really love about you too, Jenny. You're an inspiring, bright, vibrant person. What you do is good, and you spread goodness for people. And that's why even though life may sometimes be hard for you, it's always going to be rewarding and fulfilling
I
because of what you
appreciate
do and what
that.
you stand for.
I appreciate that. And, having a social media presence, you at some point reflect and you ask yourself why and why am I doing this? And it's not for recognition and it's not for accolades. It's for me has been to try and inspire and be a source of help for other people and to create value for other people. So I really appreciate you saying that. And I've always loved getting to know you and I admire how much you inspire people. And so that's, inherently full circle why I asked you to do this podcast. It was a topic I wanted to talk about, and you had the platform and the insight to help inspire and help people. And I knew that we could connect this way.
That's awesome. And by the way, about being recognized, you ought to be recognized, be recognized for your service and for what you do. It's not wrong to want significance, but to be significant in service is huge.
Huge. I agree. I think that we can use our platforms for good and we can inspire people and, we can still
Just
be
make them
proud of
feel,
it.
make them feel less alone. I mean, it's funny when I've met people before, like, I feel like I know you or whatever. It's just, we're the extended friend circle, the extended support group for all those that listen. And that's, and we're blessed that we have a platform, and we're blessed that we have the industry that's receptive to it. So I think this was noble work we've done today. I really do believe that. I think something good will come from this. And if it does, if something shifts for you, please leave a comment. Jenny would love to read that. Comment, post, share it, say something. It means a lot to us because sometimes it's lonely for us as well, because we're sitting here talking and I'm like, hey, is this meaningful for anybody? Like, this takes effort. Right. We want to know that something's actually good coming from it. So, and you can never have too much good.
I agree. I think this has been such a wonderful way to start my Friday morning. I feel my heart fulfilled right now. Good. And I appreciate you talking about it. And I'm excited to hear, if people can comment and give their feedback and let us know that they hear us and that they, what they kind of got from all of it.
Yeah, you're not alone. Don't suffer. Spread your love. Give it forward. Go for an exercise and draw. I think that's what we can say. And by the way, don't hate dentistry. Dentistry is freaking awesome. It could be whatever you want it to be. Even if you're 55 and you've been doing frenectomies your whole life, you don't have to do them anymore. Right. You can do sleep apnea and all these other things. There's not too many professions that allow you to pivot. So don't hate it. You haven't seen enough for it, or you're not creative enough to see it in a different way. So be patient and we'll get through it together.
I think that was beautifully said. I think this profession can be so beautiful, and do the work to find how this profession fulfills you, and the world is open to you. And that's the beauty of it. And we're lucky. We truly, truly are. We have a beautiful profession to grow within.
Yeah, we surely do. That's awesome. Well, Jenny, as always, an absolute pleasure. This was awesome. I know we ran, we got a good amount of time here. Hopefully everybody listens to the end. And little plug, soft plug. Yes. You're coming to the summit. This is the biggest part. This should have been the beginning. Oh, well, you have to listen till the end now. Yeah. But yes, I am. I'll be at the summit, and I will be speaking at the summit this year. This is the first time you're ever speaking at the actual summit. Like just you on a track. That's so awesome. I'm so excited. Of course, always honored and humbled to be asked to do so, and beyond excited. I enjoyed being on the panel last year so much, and meeting people afterwards that came up and asked questions. And I was just at AARD in Chicago, and a dentist came up to me and said, I saw you on the Bulletproof panel. So it's awesome. It's just really, really cool. And I'm honored. No, we're honored. Excited. We're honored. We need your voice. Your voice is important, and you bring a total different perspective. So it's awesome. By the way, your buddies are coming too. I don't know if I told you this, but Ritter and Ramsey are now speaking at the summit as well. Those are fun guys. I know. You know, what's so funny is I found out that Rob Ritter is my cousin. That is wild. Did you know this? I
think you told me. And then Ritter recently told me that you guys are
So
related.
shout out to Rob, cuz he calls me cuz now. It's so funny.
I love
We're like,
it.
it was 23andMe. We like did our genetic test and we found out we're like distant cousins. But
That's
anyway,
too
they're going to
funny.
be coming and speaking about the protocol. So the summit's going to be awesome. It's almost like sold out. It's crazy.
I'm
We're
not
gonna have a lot.
surprised.
We're gonna have a lot of people there. It's gonna be super fun, and it's Nash
It's gonna be
Vegas
great.
too. So I'm sure you love Nashville.
I haven't been to Nashville in some time, so I'm so excited you guys
Yeah.
picked this as the spot. It's going to be such a blast. The summit's always wonderful. I think this is going to be the third one that I'm going to, and
Wow.
it's fantastic. And I brought a friend with us last year and he was just blown away. So I
Good.
encourage anyone listening, go look for your tickets before they sell out. You will not be disappointed.
That's awesome. Well, anyway, great talking with you. Thanks for being so generous with your time. And thanks to all who listened. Please comment below if it was helpful. We're here for you guys and we want to make it valuable. So thanks, Jenny. Have an awesome Friday.
Thank you so much. You too.
Talk to you soon.